All right, everybody, welcome back to another episode of Beyond the Practice. Today, I'm joined by Ron Sharma. Ron is on a mission to revolutionize healthcare operations through practical AI-powered solutions. After years in healthcare operations and technology, he founded CareTrotter with a simple but powerful question. Why are the people saving lives stuck doing paperwork? Today, CareTrotter is helping clinics, hospitals, and healthcare teams across the U.S. streamline their clinical documentation, coding, and billing processes. Ron, welcome to the show.
Thanks, Nicholas, for having me. I'm excited to be here.
It's going to be a good one. All right, so we'll start with the background experience, kind of just roll on from there. So,
Absolutely.
first off, can you walk us through your personal journey in clinical documentation and how working across 21 physicians and 9 specialties shaped your vision for CareTrotter?
Absolutely. So when I joined clinical documentation as a medical scribe myself around 2017, I found that, it made me realize that clinical documentation wasn't just about typing notes, right? It was more about understanding the physician's mindset and, the clinical reasoning behind it. So that is what shaped CareTrotter's vision, basically to build a team that doesn't just document, but actually puts themselves into the shoes of the clinicians so that, we can think clinically as well.
Oh, it's great. It's great. I love it. All right. So, what key insights did you gain, from maintaining a 98.33% accuracy rate in your hands on documentation work?
Well, when I was a scribe and I was working with different specialities, it taught me that, the precision isn't just about good grammar, it's about context. So medical notes, as you know, are legal documents, they are billing resources and clinical references all at once. And one small interpretation error can impact patient care. That's
Mm.
why CareTrotter trains these scribes to think that, to think from the shoes of our healthcare professionals and not just mechanically like an AI or, just to get these things done.
Yeah, and no, it brings the personalization to it. No, that's what we need, and that legal
Absolutely.
document that's key right there. That's a key point. All right, so what are the most common challenges healthcare providers face with clinical documentation accuracy, and how does CareTrotter address these?
Well, the healthcare landscape has been changing for the last couple of years as we see that, people are moving from human scribing and going towards ambient scribing at this point of time. So I believe the most common challenges over these past years has been inconsistency and missing context. Whether it's human scribe or ambient scribing, these two have stood out for most of the part. So I believe that AI generated notes can save time, but they often omit key information, which the AI thinks that it's not relevant or it's not necessary to put this information or
Mhm.
repetitive information in the medical notes. But aside from that, they also see hallucinations in these notes that never aid or even include inaccurate clinical data. So CareTrotter has been deeply focused on solving this with our human in the loop approach. We recognize that not every provider wants to depend on technology integrations or learn new systems, to be very honest.
Oh
That's
yeah.
why we constitute our human-based clinical documentation services, which can be, go in hand with the AI-generated notes, as well as require no special setup or training from doctors.
That's it's fantastic. I know I keep saying you're gonna hear because I love what you're about. I love what the company's doing. So that's awesome. All right. So how has the traditional pricing model for medical scribing services impacted healthcare providers? And then furthermore, why did you choose to approach pricing differently?
Well, pricing hasn't changed much, to be very honest, right? The pricing in the early ages of medical transcription and scribing, it was more in transcription, it was per line base. In traditional scribing, it was per hour. So, for an example, different states have different per hour basis price.
Mhm.
So, these different pricing were there in the initial stages of clinical documentation. But as we grew, what we saw that it has been static for the last couple of years or so. So mostly a flat fee structure that you'll be seeing out there for AI generated notes or for human generated notes. It's like for AI, it's $100 per month for per
Mhm.
user, right? And for human, it's like $2,000 per month for you, right? So on paper, that sounds simple, but in reality, what you'll see is that it depends upon the consumption as well. So if you will be using more services, for an example, let's just say for an human scribe, uh, the pricing $2,000 for some companies is for 160 hours. But what if a doctor is using the scribe services for more than 160 hours? The
Yeah.
pricing will fluctuate. It will go on a higher end. And that nobody has told them. So when you are expecting as a clinician, as a small practice or medium practice, that hey, my bill for clinical documentation will be $2,000, but it's
Yeah.
gonna be somewhere around $3,000. That's intransparency, to be very honest. Right.
Yeah.
So at CareTrotter, we choose to think that, we choose to rethink this model completely. We believe that pricing should actually be aligned with the actual value and workload and not a one size fits all, right? So that's why our approach is flexible and performance oriented. So basically, if you are using a scribe for 160 hours, the pricing will be calculated accordingly. If you are using a scribe for just 4 hours a day and it will be like somewhere around 80 hours per month, you
Yeah.
will be billed that much only. It's not like, you have to pay us a monthly fees of this much. So it's totally about consumption of the scribe that you are utilizing.
Yeah, it makes perfect sense. Essentially, you pay what you get for it. I'm going to pay 2,000 for this month, but you know what? Me and the family, we have a trip planned for half the month.
Absolutely.
With CareTrotter, I'm not using it for the 2 weeks that I'm over, across seas on the beach with the family. So it's a fantastic approach, and it's got to be definitely enticing and intriguing for physicians to move that
Absolutely,
route.
and you would believe that we have a practice in Missouri who were there, who were not available for 2 months because the doctor wasn't actually on vacation with the family, and
There
for
we go.
those 2 months they didn't pay us for the scribes because they were not actually practicing, and that's what has kept them with us because in the earlier practices where they were taking services from vendors, it was mostly like, hey, whether or not you're using it, you have a contract that has been signed with us. You have to pay us $2,000,
Yeah,
right? That's what is different with CareTrotter that most of the practices are seeing at this point of time.
yeah, and then 2 months, 4 grand. But then it's not to say, oh, you pay us two grand, and then you go over the extent. That bill is going to be higher too. So,
Absolutely.
yeah. All right. So, you know, not here. We spoke in website, everything, right? You mentioned that clients see clear ROI within 3 months. Just can you share some specific examples of how CareTrotter transforms from, an expense to an asset?
Absolutely. So in most cases, when documentation is being discussed about, you will see that documentation is handled accurately. If the documentation is handled accurately, physicians can at least see approximately 3 to 5 more patients per day with
Hmm.
either human scribing or human in the loop scribing services. That alone offsets the cost because the patients that they will be seeing, the more patients they will be seeing, the less it will be a cost for them, the scribes, right? This means that within 3 months, they can see CareTrotter as an operational extension rather than just an expense, right?
Yep.
So just to give you an example, we started providing services to a couple of clinics in South Carolina region where
Hmm.
physicians were spending an average of 3 hours or so finishing just the notes after clinic hours.
Yeah.
And within the first 3 weeks of adopting our services, those after hour times actually dropped to somewhere around 70%.
Oof. Oof. Time is money. Time is money.
Absolutely.
So they're saving that, and they could use that time, the additional time, to however they feel. More patience, volume, or the personal part of it as
Absolutely.
well.
Because as we always say that, it's not only about economical ROI that we speak, it's also about the emotional ROI.
That's 1,000%, 1,000%. All right. So are there any, complimentary services that, you provide at no additional cost? And if so, how do these create value for healthcare providers?
Okay, so one of the things that really sets CareTrotter apart is that we don't believe in nickel and diming our clients, right?
Hmm.
For every add-on. That's why we offer a range of complimentary services at no additional cost, right? Along with our core documentation process, we help with patient appointment scheduling, appointment reminders, pre-charting so that physicians walk into each visit fully prepared, right? We also support with basic ICD and CPD codings as well, and we also track HEDIS measures and just to keep clinicians meet their performance standards, right? On top of that, every note that passes through CareTrotter, whether it's just for human scribing or human in the loop, it
Hmm.
goes through a quality audit, every time. So every note that has been made through CareTrotter, it goes multi layers of quality auditing before reaching the final to the doctor for signing off. So it's as good as the doctors will just be giving it a look before signing off the note.
Got it. Yeah. And I mean, the audience, the listeners, I'm in the healthcare industry myself. One of the biggest players is what? HIPAA. HIPAA compliance, HIPAA compliance. So how does CareTrotter's approach to HIPAA compliance and security, differ from standard industry practices?
Well, that's a great question because if we'll see in today's environment where so much of the conversation is around AI and automation,
Mm-hmm.
there's very little regulation that actually exists around how patient data is handled within those systems, right? Of course, there are regulations that have been in place, but those don't fully accommodate the all the areas of HIPAA, right? So some of the informations that can be protected are not protected. So at CareTrotter, what we do is that all of our professionals work from secure office environments,
Mm-hmm.
not from home or remote setups. It's no personal electronic devices are carried out on the production floor at this point of time, ensuring that no patient data actually leaves our secure framework. And we also maintain rigorous HIPAA compliance within defined protocols of both data at rest and data in transit, which means every single piece of information is encrypted, monitored, and protected at every step. And this has been going on for the last 5 years that I have been in the clinical documentation space. So I know HIPAA is a big thing in clinical documentation, and that was the first thing that I wanted to do.
That's the number one. That's a great place to start.
Absolutely.
So, we mentioned AI. Now, can you just explain, how your team collaborates with the AI companies to improve medical note generation while maintaining that, all end all be all accuracy?
Okay. So at CareTrotter, we have up until now we have collaborated with two globally leading AI companies, right? And we see that AI not as a replacement for humans, but as a powerful tool that can enhance productivity, right? But if guided correctly.
Yeah.
So that's where our team comes in. We have people who have vast experience of working with these AI tools, people from Nuance, people from Microsoft. These are the people that have been working with these companies for the last 5 to 10 years or so. So these are all professionals that know where the AI can make mistakes, that know where it can hallucinate, where it can leave information, right? So that's where our expert auditors step in to catch and correct those issues. So for an instance, we often see issues in multi-speaker encounters. AI sometimes can confuse who said what. So
Got
we can make sure that the dialogue is actually accurately attributed. We also add omitted information that the AI may have deemed unimportant but is clinically relevant. And critically, we correct any inaccurate medical context. For an example, let's just say the patient actually said that I have been, having GERD, right, which is gastrointestinal reflux disease. So I have
Yep.
been having symptoms of GERD, but the AI feels that it's not there, or they read it that their AI wrote that it's not there. GERD is not there. So we actually listen to the conversations. We actually go in there and we rectify those mistakes as well to ensure that the quality is 97% or higher at any cost.
Sounds super important, most certainly. So now, how do you see, the relationship between human expertise and AI evolving in clinical documentation over the next few years?
Okay, so I think the evolution of AI in clinical documentation is inevitable. We all know that, right? It's the future and it's already here. So most AI companies at this point of time are building tools totally aimed at replacing human scribes because that's where the value lies. Human scribes definitely are costly. AI is very much economical, especially for small practices. And definitely, if we are talking about revenue generation, big
Yeah.
hospital chains are rapidly accepting these AI tools. So I believe that this shift of replacing human scribes will happen over time, no matter
Hmm.
who says what, to be very honest. But the reality right now is that AI is not fully ready. at least not ready to operate independently. We are already seeing physicians that are raising concerns about missing information, hallucinations, inaccuracies in the notes, right? Not too much, but at least if we let's be honest, if they have to make at least 2 3 edits per note, right? They will have to go through the chart entirely, review everything line by line, and
Hmm.
see where the AI actually made a boo-boo, right? So
Yeah.
when they have to do that much amount of time, it takes, let's just say, 3 to 5 minutes of time for them to review and edit those notes. And over 30 patients, if we are talking about that, it takes somewhere around 90 to 150 minutes, just two
Yeah.
hours of time. That's what we are saving by saying that, hey, we have experts who can do this job so that you can just sign it off,
Yep.
right? You won't have to make those edits. But over the next few years, I see a hybrid model becoming the norm, that AI handles the repetitive, time consuming aspects of documentation, while human experts provide the judgment, validation, and in the contextual understanding of what is there in the medical information that should be there. And uh, this is where we intend to stay until AI matures enough to handle everything safely on its own. And it is going to be there in the next 5 years or so.
Oh, absolutely, absolutely. Anybody that doesn't get with it's going to get left behind. You and I both know that. But
Absolutely.
you've dealt with the physicians. I've dealt with the physicians. Of course,
Yes.
the skepticalness, but they're learning quickly. They are learning quickly, and they are seeing it. We've come a long way from 5 years ago, so
True.
it's
And
only going to change and grow.
and when I joined medical scribing field, it was exactly the time when medical transcriptionists were being pushed out of the market, right? So I know from that period of time wherein we were charged per line,
Yeah,
it was just about listening to whatever there was in the audio to actually implementing your critical thinking, and then towards this major, change in ambient scribing, we've
yeah,
come a long way.
yeah. All right. So now, and you touched briefly in the beginning, but really, what motivated your decision, to prioritize becoming an extension of clinical teams rather than just a service provider?
Well, this there was one time when this term of extension, operational extension of our team was coined to us by a doctor, right? They felt that what we are doing is actually as part of their team rather than being just a service provider. So what really motivated us was seeing the day-to-day challenges the physicians have to face, right? And documentation isn't just about paperwork, to be very honest, right? It's a major source of burnout, stress, and lost time at this point of time. So
Hmm.
we realized that if we wanted to make a real difference in these in the life of these doctors, we couldn't just be a service provider that we have to get the job done and then we get to go home. It's not like that, just to make just to deliver the notes and walk away. We don't want to do that. So by embedding ourselves in their clinical workflow, we move from being a vendor to being a trusted partner where we help providers, work smarter, reduce their burnout, and improve outcomes, to be very honest. So that's when we got the term that, hey, your scribes and your teams, they always behave like, they are part of our team and not CareTrotter.
Yeah,
That's how we do that.
I love it. I love it. So, how was your first hand experience influence CareTrotter's approach to training and maintaining quality standards?
Okay. So my hands-on experience in clinical documentation, I believe that it was very soon in my career when I
Mm,
realized that quality cannot be left to chance, right? It's not like today I'll be making 95% accurate notes and tomorrow, okay, it's 85, it's good. It's good enough, right?
yeah.
Uh, that is why every member of our team is taught not just to document, but think like a clinician, right? Understand the context, be in their shoes, and ensure that accuracy that can yield appropriate billing, because that's what matters the most, right? If we are making notes, the end goal is to get the doctors the money that they deserve, right? And if that is not happening, we are not providing quality services, and that is
Okay.
what we always wanted to do. On top of that, we have ongoing audits and feedback loops with the teams of, the clinical teams of these uh, physicians, the healthcare professionals. right, to maintain consistency and continually improve our performance, right?
Yeah.
This combination of clinical insight, continuous training, and human oversight actually ensures that that CareTrotter consistently is delivering the high quality product or services that we have.
Listen, Ron, I couldn't be a bigger supporter of what you're doing. I know the clinicians are gonna love it. They need it. It's cutting edge stuff, and like you said, 5 years from now, that 100% accuracy that striving for, where there's no proofreading or anything like that, that will change patient increase. It will change to the lives of them for the better, for their families, and just the sky's the limit, right? So
Absolutely.
my final two questions. All right. One, it's going to be open for what's your message to the audience, to, even if they're not healthcare providers, just anybody that's interested in learning more about, this transcribing and the AI tools that you offer. And then two, the platform to let them know where can they find more about CareTrotter.
Absolutely. So, talking about, what is my message to healthcare providers and the audience out there? It's just that we need to understand that AI is not fully ready, and there is a lot of liability on the shoulders of the doctors at this point, right? And there is already a lot of burnout on the shoulders that has been, like a baggage for them over the last few years. Just to be modest, that it's few years, but it's a lot longer than that. So what
Yeah.
I believe at this point of time is that these practices, these health systems, they need to understand that they are not actually reducing burnout if they are asking the doctors to provide low quality notes, or just average quality notes, and then get it done with through the billing teams so that they can generate revenue, but they are losing revenue, and they are asking doctors to see more patients just to get the same amount of revenue that they were trying to make. So what I believe is that quality is not a luxury at this point of time. I hear many of these doctors, many of these health systems say that quality is a luxury at this point of time. But I believe that it's a necessity, right? If we are making a chart for a patient's care, right, it should be accurate. It should be, I would say it should be 100% accurate, but I know that 100% accuracy cannot be achieved,
Yeah.
not by a human, not by AI, but I believe by a combination of both, we can, be somewhere around 99% or 99.9%. We never know. So I believe that they need to understand that at this point of time, human in the loop is what matters the most, is
Yeah.
what the forward step should look like. And there needs to be a framework for it. The right framework for human in the loop services will lead to better results. And those who will accept it in the early stages, they will lead the clinical documentation space in the future. Because let's be honest, many of these AI scribe companies, they are just here to make quick money. Very few of them are here to stay for a longer period of time,
Yep.
right? And that's what we want. Those companies who want to stay for a longer period of time, they should be here. And it's not like we are the only ones doing these human in the loop.
Hmm.
So just partner with us. It's
Yeah.
it's about passing on the message that there are others like us, and that's what they need to go through, right? They need to ask people who are there in the human in the loop stage or phase, and they should partner with them to provide the quality to the doctors.
It's beautiful. Beautiful, right? So now for the
Thank you.
listeners, where can they find more about CareTrotter?
Well, they can find us on our website, which is www.caretrotter.com. My LinkedIn profile is very active. I'm very active on my LinkedIn profile, right? They can find me there. But if they just want to call, I can, share my numbers as well on my profile. They can just call me there.
All right, awesome. It was great stuff. Can't thank you enough for being on the show. I hope you enjoyed as much as I did. And,
Absolutely.
good luck with everything in the future. All right, Ron?
Thanks, Nicholas.
All right, have a good night.
You too.